Hi, my name is Jenny Rush, and I'm here to introduce myself and Lymethriving. There are many people in the Lyme community who kept me company through the last year of illness, so are familiar with me. However, Lymethriving has been around for a couple of years now, and new people are not familiar with me, and as a result, have questions about me and Lymethriving. So here are some questions I get asked, and I'm hoping this will help shed a little light and make the introduction a little more comprehensive. All right, so it's just going to be like questions, the kind of questions that I get asked by people. So first question, what was my Lyme experience? I first tested positive for Lyme about 16 years ago, I think, give or take. I was symptomatic for about a year before getting tested and was fortunate to test positive right away. The first round of illness lasted about 18 months. And then I was well for a number of years. And then I had several years of being ill in cycles. I'd get ill, I would treat with protocols, then I'd get well, and then I would get sick again. The last year of my illness is what I tend to share about most. It was the year that I was the sickest, dealing with multiple symptoms that most Lyme patients deal with. The most prominent symptoms were cognitive issues, memory loss, brain fog, pain, suicidal depression, and debilitating fatigue that I think most people are familiar with. Question, what treatment protocols did I follow? The first time I treated for Lyme, I was using or trying to use antibiotics. We discovered that I was allergic to each of the different types of antibiotics used, so eventually we stopped that. The next few rounds I treated with alternative methods like bioresonance and herbals. And then during the last year, I treated holistically, meaning that my whole being was being addressed. So I changed my diet, I detoxed, I took a variety of supplements, enzymes, and amino acids. I also included chiropractic care, energy work, and literally anything else that felt right. And while that was pretty consuming, I put the majority of my focus on addressing the emotional and spiritual side of things. Question, what one thing do you think made the biggest difference in getting well? Everything works together. I think everything works together. So each aspect of my treatment was necessary in some way. The best analogy I have come up with to describe it is this. If the treatment protocols are the vehicle to getting well, then the emotional and spiritual work is the fuel in the tank of that vehicle. So they all work together. Question, was there a turnaround point during the last year? Yes. When I was my most miserable, feeling the most sick, struggling to string words together into sentences, quite sure that death was imminent, I surrendered. And what surrender looked like was me throwing myself onto the couch in a fit of exhaustion and stopping everything. I stopped trying to be well. I stopped trying to think in sentences. I stopped trying to figure out everything. And I stopped trying to get things done. It was a pure pause. And in that pause, peace was able to be expressed into my experience. I was completely surprised. It was the most quiet and beautiful thing ever. And as I lay there, I had a knowing that my true self was not my body or my mind, that who I truly am is not broken, but in fact, whole and complete. In that knowing was the awareness of oneness with everything and a profound experience of love. And I felt completely fulfilled. Now, feeling completely fulfilled meant I had no experience of lack or need. I was aware that my body was still expressing illness, but there was no lack or need. And I knew that regardless of whether I got well again or not, complete fulfillment was available. And getting well as a means to an end fell away. I still wanted to get well, but I just didn't need to. I also realized that my body was not expressing illness. It was simply expressing itself exactly as it was. And I had such a deep experience of compassion for it that this was literally the best it could do. Question, having had the experience of waking up to your true self, was the remainder of your illness easier or different? In the 9 months following this realization of self, I continued to follow my protocols, but what was different was that the protocols were no longer being used to get rid of the illness, but rather they were a loving offering to restore the integrity of my immune system and to support my body back into balance. I had my off days, I can assure you, but for the most part, that was the difference in how I experienced going through the treatments. The messy part was the emotional and spiritual side of things. I went through numerous significant emotional breakdowns along the way, each of which released me from a belief or a patterned way of being that no longer served me. And what helped me through each of those crash and burns was the memory of that earlier realization of my true identity. So I could kind of abide back in that realization and allow peace to come through into my experience again. Question. Sorry. Why did you start Lymethriving? One of the things I noticed was that the Lyme support groups were an amazing resource for information on testing and treatments. They were also great for finding companionship, where there was a giving and receiving of emotional support. Beautiful. I made some wonderful friends in these groups, but I also noticed for myself that spending too much time in conversations about illness, about the impact of illness, the testing for illness, and the treatment of illness kept me in the world of illness and as a victim of it. I used to break away from time to time and then watch inspiring documentaries or movies and found that energetically I felt so much better from that type of engagement. And then as time went on, I felt more and more drawn to uplifting and empowering conversations and spiritual inquiries. So Lymethriving came into existence as a place to explore those things. And it was a Facebook page. It's there in its entirety. Question. When did the teleconferences begin and what are they about? At the beginning of 2012, Lisa Hilton and I decided to start hosting free teleconference calls where we could explore various topics in the spiritual and emotional realm of chronic illness. These are simply, the calls are simply an invitation for people to take a break from all the information overload of treating illness and taking a look within themselves through the various challenges of illness to discover their true selves. An example of some of the topics that we've covered are surrender, forgiveness, anger, and depression. And there's lots of other topics that we've covered as well. And then at some point along the way, we began having guest speakers who are healthcare providers with an expertise in Lyme disease. My commitment to having alternative practitioners as guests is because many people can no longer afford care. So this was an opportunity for them to learn or hear different ways of care that could be self-implemented in the event someone heard something that resonated with them. Question. Are you a Lyme activist? The world of Lyme disease is complicated, as we know. It's riddled with politics and poor testing and underfunded research, misdiagnosed and undertreated patients, and of course the list goes on. They are activists who strive relentlessly to bring change to all these areas, and patients wait for change so that they can get well and have their lives back. While change is underway, how many years will it be before patients can get tested, treated by educated healthcare professionals, and then be able to move on with life? What if it's 5 years? What if it's 10 years or 15 years away? So while I am completely supportive of these activism causes, my calling is in a different area of the Lyme world. It is to each person right now. So rather than waiting for any amount of time to pass, why not uncover the peace and happiness that is at the core of your being right now? Rather than being at the effect of illness, why not use it as an opportunity to realize your true self? There is still the tending to the body with appropriate treatments, but tending to it from a place of love and peace is profoundly more effective than tending to it from a place of fear and resistance. Question. Can you share some information about the Lyme retreats? These gatherings are not focused on the illness or its treatments, but rather on exploring the true nature of who we are beneath illness, beneath the suffering, to realize the peace and love that is ever present. This supports transforming our relationship to and the experience of the challenges of illness. The meetings are informal and relaxed, and there is the absolutely delicious experience of immediate family and immeasurable love. So I hope this has been helpful as a way of introducing myself. Feel free to visit my website, where there is even more information and a lot of blog postings about everything that I've shared here. The address to my website is lymethriving.com. If you have any questions, please feel free to contact me. All my contact information is also available on the website, as well as links to the variety of social media places where you can find me. Much love to you all.